Throughout most of history, practicing medicine was largely a matter of trial and error. Try a bunch of things from nature, throw out what doesn't work, and hold on to what does. Over long periods of time, medicines would get whittled down to a few substances that could treat diseases pretty well, but it wasn't exactly efficient and could sometimes have some very unfortunate consequences. Eventually, the search for medicines moved out of the natural world and into the laboratory. But even as recently as the 20th century, the strategy was largely the same: trial and error. Most of our common illnesses today already have a prescription. But what if you had some new disease, and your doctor just told you to try a bunch of different medicines until you felt better?
You'd probably be a little annoyed, right? Nervous even? Thankfully, scientists now have some new tools to find the medicine you need before it goes into your body or anyone else's. This is the story of a CUNY graduate who became a Nobel Laureate in the development of rational drug design.
It was a very cold winter night in 1918 when Gertrude Elion was born. So cold, in fact, that the pipes in their Manhattan apartment froze and burst. Luckily, it was a rare discomfort for the relatively well-off family. Gertrude's father, Robert, had immigrated from Lithuania to the U.S., where he graduated from NYU School of Dentistry and subsequently opened a business. Her mother, Bertha, from modern-day Poland, had not received an education herself, but understood the importance of one, and she wanted Gertrude to have a career. However, when the time came for Gertrude to go to college, the family's fortunes had changed. Robert had invested a great deal in the stock market, and although he managed to keep his business, the crash of 1929 meant there was no money to spend on tuition. Luckily for Gertrude, there was a college that didn't ask for any. Had it not been that Hunter College was a free college, she later wrote in her Nobel autobiography, I suspect I might never have received a higher education. With the problem of cost now behind her, Gertrude's only dilemma was what to study. Ultimately, it was a personal loss that helped her decide. Her grandfather had recently passed away from stomach cancer, and she had been by his side in the hospital until the end. The experience moved her deeply, and she decided she was going to do something about cancer. Pursuing a career in the development of new drugs, she majored in chemistry at Hunter College and graduated in 1937. Gertrude was eager to find work doing research, but found doors closed to her. You're qualified, she recalled being told, but we've never had a woman in the laboratory before, and we think you'd be a distracting influence. Instead, she continued her education at NYU, which she paid for by working as a substitute teacher and doctor's receptionist. She also met the love of her life, Leonard Cantor, a brilliant young statistician from City College who had the highest GPA in the school's history. The two connected over a shared love of concerts and theater and over long conversations about science and were soon engaged to marry. But in 1941, tragedy struck. Leonard contracted a heart infection and died after battling the disease for more than 6 months. Witnessing yet another loved one pass away made Gertrude more determined than ever to spend her life fighting diseases. She never remarried and threw herself into her work. After receiving her master's degree in chemistry, Gertrude was finally able to find a job in a laboratory. But it wasn't doing research. Instead, she worked in quality control for the grocery chain A&P, testing the acidity of pickles and the color of mayonnaise. The job gave her valuable experience with lab equipment, but she still hungered for real research. Looking for new opportunities, she came across a small research group in Tuckahoe, New York. The researchers there took turns interviewing applicants, and by chance, the scientist conducting interviews when Gertrude arrived was Dr. George Hitchings. George was greatly impressed with the young applicant and offered her an assistant position in his laboratory. Hitchings' lab was focused on rational drug design, a radical idea that drugs could be developed more efficiently by understanding how cells and viruses reproduced. Hitchens hypothesized that scientists could find a rational way to interfere with the DNA replication process and, by doing so, prevent the growth of pathogen cells in the body. In order to accomplish this goal, Gertrude and her colleagues needed to take a closer look into the synthesis of DNA in disease-causing cells. In the next several years, Gertrude focused her work on purines, the chemical compounds that make up DNA. Her goal was twofold. First, she needed to develop a compound similar to purine, a kind of cuckoo egg of biochemical processes. By fooling a cell into accepting it as part of its genetic material, this imposter purine would then ruin the replication process of the DNA it had entered, thus stopping cellular growth. But not just any imposter purine would do. Gertrude's chemical candidate would need to interfere only with disease cells and not the healthy cells. If it interfered with both, then the medicine would, in the words of Francis Bacon, cure the disease and kill the patient. Luckily for Gertrude, she and George had found that normal cells, cancer cells, and microbes all use the building blocks of DNA differently. In theory, it should be possible to target some cells and not others. After several years of research, Gertrude's tireless study of purines began to prove fruitful. In 1948, she and George discovered a compound called diaminopurine. The chemical inhibited the growth of certain bacteria and leukemia cells, but still had some toxic side effects in patients. Nonetheless encouraged, Gertrude continued her dive into purines and in 1951 made a breakthrough. 6-mercaptopurine was a chemical that attacked leukemia cells but not healthy cells, meeting both requirements she and George were looking for in a drug. In collaboration with the Sloan Kettering Institute, the drug was rushed into production, and although its long-term efficacy was limited, 1/3 of all patients receiving it went into complete remission. But Gertrude didn't stop at leukemia. In 1957, by making a simple chemical alteration to 6-mercaptopurine, she and George developed another drug named azathioprine. The new drug was able to inhibit white blood cells that were rejecting organ transplants and has since allowed tens of thousands of patients to receive new organs. Over the succeeding decades, Gertrude's work led to the development of treatments for gout, malaria, and bacterial infections. It also led to the development of AZT, the first drug widely used in the fight against AIDS. But the final jewel of her career came in 1978 with the introduction of acyclovir, a compound that came to be known as the first successful antiviral drug. Originally used for treatment of herpes, this medication heralded a new era of therapeutic medicines and eventually led to the development of antiviral drugs such as Paxlovid, the drug now commonly used for the treatment of COVID-19. Back in New York, as a young student entering Hunter College, Gertrude had decided she would do something about cancer. A few short decades later, she had indeed done something about it, as well as malaria, AIDS, and a whole host of other diseases, saving thousands of lives in the process. In 1988, Gertrude Elion and George Hitchens were awarded the Nobel Prize in Physiology or Medicine for their discoveries of important principles for drug treatment.
Thanks to Gertrude Elion, medicine became a lot more than just rolling the dice. That should make us all feel better.